Hi there, my name is Sylvia North. I'm a New Zealand registered dietitian and representative from Celiac New Zealand and the Medical Advisory Panel. And the Celiac New Zealand Medical Advisory Panel has brought for you this presentation. For more information about how we support those living with celiac disease in New Zealand, you can check out our website, and there's lots of resources and information there. So today, this webinar is about the celiac journey. So it's about maybe some of those ongoing issues or ongoing problems that might pop up through your journey with starting a gluten-free lifestyle. And the reason why we think of it as a journey is, because although celiac disease can be treated very, very well and effectively with a gluten-free diet, it's a gluten-free diet for life, and it's a lifelong commitment that comes with many challenges. So let's dive into some of those challenges that you might come into. Now, first of all, your point of call for follow-up support is always your general practitioner. And so what's really important to know is that your symptoms should improve within a few weeks of starting a gluten-free diet. However, it may take some months for some problems to totally resolve. So it's really important to have an ongoing relationship with your GP, because they are your advocate for continuing to test if there are ongoing issues. They're going to help you identify whether you've got nutrient deficiencies or problems like anemia. And in your regular reviews, we have particular recommendations for what sort of blood tests might be carried out. So that means your antibody levels get regularly tested. So we talked about the antibodies when we talked about diagnosis. Now, the really cool thing about the blood marker, your TGG antibodies, is that since we use them to diagnose someone with celiac disease when there's active disease, we can actually use this as a measure for if you're actually still being exposed to gluten. And this can be a really good screen if you have ongoing symptoms, but perhaps you think you're following a gluten-free diet, but there might be some accidental or unintentional exposure happening somewhere in your life. Your doctor also has a really helpful and important role to check your immune status, to check your iron levels, your B12 levels, and you also should qualify for regular bone density checking and to assess your risk of low bone density or osteoporosis. But what about when symptoms don't stop? So there might be a handful of those, what we call head scratcher patients, or those with celiac disease who just don't follow that perfect trajectory of, just started gluten-free and everything was all of a sudden better. And so we can break this down into three categories of when someone's symptoms don't get better. So first of all, you might not be strictly gluten-free all the time. And sometimes that might be through just a lack of appreciation of what gluten-free for life really means. It might even be accidental gluten exposure. So you might be going out to restaurants or to work functions where people say, yes, it's gluten-free, it's safe, and it's in fact not. And one of the main sources of this accidental gluten exposure is going to be happening through cross-contamination. And this is where I'll encourage you to look back at the previous cross-contamination webinar, where we talk about all the sources of where that can happen, because it can happen in many places, in your work and at your home, and being a real strong advocate for yourself around gluten exposure is really key there. Then the third reason why someone might have ongoing symptoms, whether it be gut-related symptoms or fatigue, could be potentially another dietary intolerance that's not gluten. And one of the main first dietary intolerances that we might see is lactose intolerance, which we covered in the previous webinar. So what's really important here to know is that sometimes it can be common for symptoms to not improve or not stop totally, and this is where we can start looking for those other causes. So if it's accidental gluten exposure, how do you know? You don't. You have to double check. So you double and you triple check everything that's going into your mouth. So this starts with the food that you're eating on a regular basis. Look at all the food labels in your home. Look at all the food labels of the things that go into your shopping trolley again. And don't be scared of food labels. They are sometimes all laid out in different formats, but the more you read, the more comfortable you will get with them. You need to read food labels. Looking at the front of the packet and seeing that it's just a tomato sauce, what could be the worst problem, is not good enough. Look at food labels. And if you're not sure, if you're not in doubt, reach out to the community, because we've got a really awesome community of people with celiac disease who've read all the food labels too. So food labels, that's right. A really common source would be foods that don't come with labels, and that can be from buying bulk bin type products. And that's not really intentional of the food producer that they've mixed the gluten together. But what can happen is you can buy a bulk bin ground linseed or some nuts in one area that's been used with the same scoop of someone who's scooped out some wholemeal flour or some kind of other snack food that's had gluten crumbs on it. You can check all your shared spaces and all your other places that you prepare meals. So recheck the home and work environment. Have you just had a new colleague that's come in and started using your toaster, using your butter container? Some people might bring their own butter into work and put a sticker on it and say, this is mine, and it's not because I'm being rude or because I'm being particular. It's actually because I just need you to not put your gluten crummy knife in my butter. Thank you. Also check home. So what might be happening is there might be one condiment that you just found from a recommendation of a friend, and you started using it because it's really, really delicious, but hey, it's actually got gluten in it. Or someone else at home is cooking for you. They didn't quite pick up on the problem with mixed frying. New pieces of equipment can sometimes be a problem. If you buy one of those air fryers where it's not quite as easy to clean, that might be a source of cross-contamination. Someone else in the household is using it. A lesser obvious source of accidental exposure might be through cosmetics. And so it's not necessarily all cosmetics, but more so things that are going to sit around your face and potentially be swallowed or ingested. And so that could be things like lipsticks, lip glosses, lotions and moisturizers that sit on the skin for a long time. So they're more likely to be ingested. Toothpastes as well, because they're going to go through the oral route. Now, you need to be an advocate for yourself in every food outlet. Okay? So for cafes, restaurants, look to find out whether the staff actually know the significance of what gluten-free really means. And so you can pick up on little signs like, if they're storing the gluten-free muffins right next to the regular muffins, then they're not helping you. You need to see people wrapping the gluten-free totally separately, storing it in a different cabinet using different tongs, and clarify the fact that you have celiac disease, you have a gluten allergy. You don't just get bloated or a sore stomach when you get gluten exposure, you actually get quite sick. And if in doubt, if you have ticked all your boxes and gone through the home and cleaned up all these possible places, then see a dietitian, because they're also super skilled in pulling apart where possible issues could be coming from. And if it's not related to gluten. So sometimes we see a number of ongoing symptoms that might be similar to the celiac disease symptoms, but are also linked to other food intolerances. So that could be more gut-related symptoms, so constipation, diarrhea, bloating, wind, reflux, or characteristic irritable bowel syndrome. And if this is the case, if this sort of stuff is going on, then it's a really good idea to discuss with your GP, to explore alternative causes and explore where these issues might be stemming from, and if needed, then they may refer you on to a dietitian for extra support around food intolerances and managing these symptoms. Another awesome place for more support is Celiac New Zealand, and so Celiac New Zealand has a website with a members only section with a lot of information. If you're travelling outside of New Zealand, then look for some support from your local Celiac association, and some of these places can be very helpful with places to go, lists of how to read through labels, and some really sort of important nuances with travelling in the area. So, in summary, your GP is the first point of call for ongoing care. So, develop a good relationship with your GP, a trusting relationship where you can bring up ongoing issues. It's not normal to experience ongoing symptoms for several months after being diagnosed, and if that's happening, it might be related to accidental gluten exposure. So it's really important to get to the bottom of that exposure by checking your food products and identifying where that exposure is coming from. So, because if you are getting this ongoing exposure, then you do dramatically increase your risk of issues. Other food intolerances may play a role, and we do tend to sometimes see food intolerances in those with celiac disease because there's been so much alteration to the gut and inflammation. And if that's the case, then one of the best people to see is a dietitian who can give you specific support regarding these ongoing issues and get to the bottom of the problem. And a really good point of call is joining with Celiac New Zealand for that local support and community updates, where you can link with your community, learn more about local products and local services that are available that suit you, and make your journey as supported and comfortable as possible. So thank you for listening today. This presentation was prepared for you by myself and my colleague Margaret. We are both New Zealand registered dietitians and representatives from the Celiac New Zealand Medical Advisory Panel. And thank you for listening. It's been an absolute pleasure.